Good evening, everybody. Aquatic here with the Real Report. Tonight we're going to be covering everything up to date with monkeypox. Also, a big shout out to all the new subscribers and to a special new subscriber from a new location in Tahiti. So thank you guys very much. Go ahead and hit that subscribe button with the notification bell. Give me a like if you could. Let's try and shoot for 20 and leave a comment down below, even if it's just a thumbs up. It really helps the algo. Alright guys, hopping into the Real Report on the night shift. Austin officials issue emergency order as local monkeypox cases rise. That's from 4 p.m. today. Local authorities, including Austin Mayor Steve Adler, declare a joint emergency order regarding rising cases of monkeypox in the Austin area. They said, we need the federal government to increase the amount of vaccines available and that there's limited supplies of vaccine resources. They're calling on the state and federal partners to help get more vaccines. They noted here, which is going to be a reoccurring theme in tonight's report, about the known cases and the symptoms: fever, body aches, chills, fatigue, pimple-like bumps on many parts of the body. Infection can spread by touching of skin containing the scabs or lesions and their related fluids, as well as via respiratory secretions. So Walk said masking is important. Hopping on to the next one from C-SPAN, White House monkeypox response team is holding briefings. So this is looking very reminiscent of 2020.
And protect communities most at risk. This has been a top priority of President Biden and the entire administration. And today's...
So you guys, if you want to go watch the clip, you can look up White House monkeypox response team holds briefing, anywhere from C-SPAN to the White House YouTube, I'm pretty sure. Just an interesting thing to note as things look more and more like something we've seen before. Here over at Reuters, U.S. allows alternate monkeypox vaccine injection method to boost supply. They said from the U.S. health regulators they've authorized injecting a monkeypox vaccine intradermally in adults, meaning between layers of the skin rather than below the skin. In an effort to stretch out low vaccine supplies, the U.S. Food and Drug Administration announced Tuesday. The FDA authorization comes after the United States and World Health Organization declared monkeypox a public health emergency to bolster the response against the outbreak. They said 2 doses of the vaccine given 4 weeks apart will still be needed with the intradermal method. The FDA approval also allows people under 18 to receive the vaccine by subcutaneous injection if they are determined to be at high risk of monkeypox infection. The FDA is staying with this method for children as it is easier to administer and there is not as much data available. FDA has been given the ability to authorize emergency use of the monkeypox vaccines. Again, just another one to confirm that. Japan's third monkeypox infection appears at Yokota Air Base in Tokyo. Yokota Air Base in western Tokyo is home of U.S. forces in Japan, the 5th Air Force, and the 374th Airlift Wing. Yokota Air Base, Japan. The third case of monkeypox has appeared at the U.S. Airlift Hub in western Tokyo from their Minister of Health. Man affiliated with Yokota went to urgent care. The patient was immediately placed in quarantine Thursday as a precautionary measure and has not had any known contact with individuals suspected of having monkeypox. Again, another reoccurring theme of quarantines, more vaccines, vaccine shortages. They're already talking about multiple doses of the vaccines. So you guys can likely see where things are headed. You know, things aren't a coincidence when the trajectory has multiple confirmations. That's probably where we're going. Noteworthy though, Center for Disease Control, CDC Prevention, said more than 7,500 cases have been confirmed in the United States as of Friday, so that's an old number, which we'll get to the new one in just a second. 28,000 infections in 88 regions around the world. Here from military.com, talking about the U.S. military cases, not just in Japan, but the number of monkeypox cases in the military climbs tenfold in less than 4 weeks. Bit of a fear-mongering headline, given that the number of monkeypox has climbed to only 40. Granted, when you go from 4 to 40, yes, I understand. However, the headline is kind of deceiving. Defense Department spokesman said Friday the figure included 26 active duty personnel, which I think is the takeaway here. KDHE identifies probable monkeypox family cluster in Shawnee County in Kansas City, Missouri. The Kansas Department of Health and Environment said it identified a probable case of monkeypox. State officials said it based on testing for laboratories and close contacts with the family. So they're already doing contact tracing. Again, another takeaway I thought was worth mentioning. Authorities said the family members were exposed by an out-of-state visitor. Shared through items such as towels, linens, cups, utensils that can contain the virus. They're talking about that typical cases, person may experience symptoms including fever, headache, muscle aches, swollen lymph nodes, chills, exhaustion, followed by the appearance of a rash that can look like pimples or blisters that may appear on the face, inside the mouth, and other parts of the body like hands, feet, chest, or genitals. Health officials said that not all individuals will have symptoms before the onset of a rash. So, if anyone's experiencing symptoms, go see your primary health provider. However, based on what everyone has said so far, it's being misdiagnosed at a very alarming rate. Here, U.S. triples monkeypox cases in 15 days with the latest daily count of 1,424 added to the overall numbers. So as of Monday, the U.S. had the world's most number of confirmed cases of monkeypox, which stood at 8,934. Made up almost 30% of the global total, 30,189. Again, guys, with an incubation period of 1 to 21 days, it's not 30,000 around the world. It's easily 120,000. So keep that in mind as the numbers start to go parabolic. Ecuador's monkeypox cases rise to 10 with 1 death. However, they noted that it was pre-existing ailments. Total confirmed monkeypox cases, again, with the United States leading the pack with 8,900. Spain creeping up towards that 5,500 mark. Germany just shy of 3,000. United Kingdom just shy of 3,000. France 2,400. Brazil 2,100, with another 2,000 suspected. Canada just shy of 1,000. Netherlands 1,000. Portugal under 1,000. Italy 500. Peru 500 cases as well. Monkeypox can survive for weeks in water and on refrigerated food. This one's out of Tech and Science Newsweek, which I think is noteworthy as we try to learn more and more in the coming days, weeks, and months what's really going on. However, monkeypox virus, they're saying, can remain stable for days and even weeks on refrigerated food and in water. Ugh. According to a report from the U.S. Department of Homeland Security's DHS Science and Technology Directorate, monkeypox is continuing to spread around the world. And we head down here to the report describing monkeypox as, quote, very stable in the environment, and says it can live for days to weeks in water, soil, and on refrigerated food. It adds that the virus can live for months to years inside of scabs. The report does not say how long the virus can survive on surfaces, but the CDC says investigators found the live virus 15 days after a patient's home was left unoccupied, according to one study. CDC also said pox viruses like monkeypox can survive in linens, clothing, and surfaces particularly well in dark, cool environments. Again, the misconception that it is primarily bodily fluids in the homosexual community is obviously false when they're telling you it can be on all surfaces, handshakes, linens, clothing, etc. Porous materials like bedding and clothing may harbor live viruses for longer than non-porous materials like plastic, glass, or metal, the CDC says. Virus can also spread via direct contact with the rash it causes, contact with body fluids, contact with respiratory secretions, and intimate contact like sex, kissing, hugging, and prolonged face-to-face contact. CDC also said pregnant women can spread the virus to the fetus, and people can catch the virus from infected animals, including animals' meat. Again, refrigerated food. According to the DHS report, the basic reproduction number, or R value, keep a close eye on that one. That was the biggest indication early on that COVID was going to go parabolic. The higher the number, the more people it will infect quicker. For monkeypox, it's estimated to be 0.57 to 0.96, though they have recorded a value of 1.25. Again, the virus's R number refers to how many people will be infected by each infected person. The R value for the current outbreak is not known, they admit. However, they do note that the rate of monkeypox has increased over time. Air Force is now providing vaccines for airmen as monkeypox cases rise. Monkeypox update from India. Noteworthy, they just confirmed more than 85 countries, including India, and it's also known in most countries. They're talking about the specifics of the B1 strain of the virus is increasing the problems. Coming down here, there's also the presence of the A2 strain of monkeypox in the country. However, they do note, pay attention here, it is worth noting that the same strain has been found in America last year. However, the prevention methods are strict now, then it can be prevented from spreading. Again, guys, pay attention to that. If the prevention methods are strict now, then it can be prevented from spreading. What happened in 2020 when the world shut down? Yeah. Here from Stat, this is a really interesting one I found. Red Cross beginning to screen blood donors for monkeypox. U.S. are taking steps to safeguard the nation's blood supply, with the Red Cross checking for the distinctive lesions that are a hallmark of the disease. Beginning in October, the Red Cross will require individuals who have been diagnosed with monkeypox or exposed to someone with a monkeypox infection to wait at least 21 days before giving blood. Here out of the Lancet, published this week, they found that 6 out of 7 patients diagnosed with monkeypox in the UK between 2018 and 2021 had detectable virus in their blood samples, and another reported out of the New England Journal of Medicine that they had found monkeypox virus in a handful of blood samples taken from their patients. Another one from around the world, out of BBC, Ghana confirms its first monkeypox death. However, they note infected person was a military officer who died 3 days after going to the hospital, so I assume he went very late into the stages. 13 people who are believed to have come into a contact with the man who died are in isolation. From Fox 28, they're just talking about monkeypox and going back to school again after everything we learned and just went over. That's probably going to be something to consider. I don't know if they're going to, lock down, make the kids homeschool again, and decimate our education's quality even more. I don't know if that's possible, but something to consider if you have kids at home. Monkeypox reported at Sterling Heights assembly plant as infections rise across the Detroit area. Work at Shap or another auto plant. Again, that was the Sterling Heights assembly plant acronym. The report of monkeypox cases at the Sterling Heights assembly plant is not just a risk to the 7,000 Stellantis employees who work there, but obviously to the wider population around Detroit. Through contaminated fabric and surfaces, again, same theme, virus can remain alive for weeks outside the body, contrary to the claim that monkeypox is a threat mainly to gay men. Past studies indicate that over 40% of infections occur among women. Some 10% of those infections require hospitalization due to the severe symptoms. So here's a picture, not for the easily nauseated. All right, guys. I just wanted to update everybody on that. That's what I know so far. So if you guys learned anything or you guys found this information useful, please leave a like. Really helps me out. And hit that subscribe, share with friends, family, etc. The channel is making leaps and bounds. So thank you guys. Have a good night.